Now, pharmacology, the first thing in general pharmacology, what we are going to learn is a topic by the name pharmacokinetics. The topic name is pharmacokinetics. Now, what do you understand by pharmacokinetics? See, it's two words. Remember, pharma means means drug, and kinetics means what? Kinetics means movement of the drug. So, pharma is drug, and kinetics means movement of the drug. Now, pharmacokinetics is study of drug movement. So, what are the four things which we have to study in pharmacokinetics? Are these things. So, pharmacokinetics, when I tell, it is these four things. That is ADME, four important things. What are those four important things? A stands for absorption. So, absorption of the drug. And D stands for distribution of the drug, and M is the metabolism, and E stands for the excretion of the drug. E is excretion of the drug. So, pharmacokinetic in total is these four things. Let me repeat again: absorption, distribution, metabolism, and excretion. These four concepts we call it as the pharmacokinetics. Clear? To understand pharmacokinetics, it's simple. From the beginning, I'm giving a standard drug. For example, that is paracetamol. Now, I will understand pharmacokinetics by a simple example of paracetamol. Now, let us assume that a patient has fever and he is taking paracetamol 500 mg. So, he is taking 500 mg of paracetamol. Now, this paracetamol is given oral, so he has to swallow this. Now, what happens when the paracetamol is taken? Now, I have a query for all of you. Suppose you want to take the tablet, whether you will take the tablet then drink water, or you take some amount of water, then put the tablet, then drink the water. So, what will you do? So, waiting for your answers. So, let us assume that we are taking this paracetamol oral for fever. Now, when the patient swallows this, when the person swallows this tablet, so this is the mouth, and through the mouth he is swallowing this, and it will enter from the mouth to the esophagus. It will enter through the esophagus, and from the esophagus it reaches the stomach. Now the paracetamol reaches the stomach, and this is the intestine. So this is the intestine part, and I'll write something called liver here. So this is the liver, and liver is attached to the intestine by the biliary tract. Now the paracetamol which you have taken, it enters like this. It enters when you swallow this tablet, and what happens? The tablet is a solid. Now it has to undergo disintegration. That means the tablet is hard, right? So it has to undergo powder form. So this is called disintegration. The tablet will undergo disintegration. So disintegration. Now after disintegrating, the drug will dissolve, and it is called dissolution. It is called dissolution. That means the drug will dissolve inside. So that's the reason when we are giving to a baby, we use a solution for a baby, because in the baby the disintegration takes time. So we use solutions or suspension in a baby. Now once that happens, the paracetamol comes here in the intestine. From the intestine it gets absorbed. From the intestine it gets absorbed by the portal vein. It gets absorbed by the portal vein. So now the paracetamol enters inside. Right, the paracetamol has entered inside and it has gone to the liver. Now in the liver, it will undergo some metabolism in the beginning. It will undergo some metabolism in the beginning. And after that, from the liver, through one more portal that is called inferior vena cava, it reaches the heart. So it reaches another system, that is the heart. Now the paracetamol, where is your paracetamol? Now the paracetamol is in the heart. So from here, it has entered the heart. So will that stay in the heart only? It has to be distributed. Where is the fever center located? In the brain. So now the heart has to push this drug, distribute this drug to various tissues, and through what it will distribute? It will distribute through blood vessel. It will distribute through blood vessel. Yes, I got so many answers here. Now, ideal way is, it can be taken either way, but ideal way is take a bit of water, then put the tablet, then drink the rest of the water. Now, why this is followed? Suppose you take the tablet like that, most of the tablets have bitter taste, and many people will vomit that. And a bitter taste, people don't like to take it again and again. So better if you are giving it water, then the tablet, then full glass of water. So this is the ideal way. Okay. Yes, Agnivesh, Darya, hi Dagini, Kunal, thank you for the answers. Even Manav, Parya. Now, it has to come to blood vessel. From the blood vessel will go to the various tissues. So let me write a big blood vessel. This is the blood vessel. It goes to the blood vessel. Now the paracetamol is available two form. One is called, it is bound form, and one more form is called, it is available as free form. The drug is bound or free form. I will tell you what is bound later. Just right now, take it. Now the free form of the drug will go, mainly in case of paracetamol, it will go to the brain. It will go to the brain and it will produce action. So it will go to the brain and it will produce action. In case of paracetamol, what is action? It decreases fever. And this action is what we call it as pharmacodynamics. Pharmacodynamics is the action produced by the drug. So that I will deal separately. So this is called pharmacodynamics. So we will have separate topic for that. The action of the drug is called pharmacodynamics. Now paracetamol has entered the brain and has done its work. Now do you think it will remain in the brain forever? One tablet of paracetamol, will it cure the fever forever? No. So if that is the case, one tablet of sleeping tablet would have made everybody sleep forever. They will not get up at all. That's the reason it has to be thrown out. Now from the tissue, the drug will come back again to the blood vessel. Or this drug may also be stored in the tissues. It may be stored in the tissues and after some days it will come back. So for action, what it will do is, it will go out, it will get stored in tissue or produce action, and after a few hours or days, depending on the drug, it will come back to the blood vessel. Now the moving out of the drug is what we call by distribution. Now the drug is distributed mainly for its site of action. Now once the drug has done its action, now the drug has to be removed out. Now the drug will be removed out by this way. So it moves from the blood vessel to the liver, and in the liver we will get metabolism of the drug. Now once the metabolism is done, then the drug passes back and it will be excreted out. So it will be excreted out mainly by the kidneys and also by the liver. So the drug will be excreted out. Right. So this is what happens when you take a drug. So when you take a drug, just see this image and tell me, first the drug was absorbed, then it was distributed, it was metabolized, and later it was excreted out of the body. And that's why we have to take the drug, paracetamol tablet, repeatedly. So what actually your body is doing, it is absorbing, distributing, metabolizing, and excreting the drug. So that's the reason this pharmacokinetics is also called what body does to the drug. Now what is the drug doing to the, what is the body doing to the drug? It is absorbing, distributing, metabolizing, and excreting the drug out. So we took the simple paracetamol and this is the image which will give it a very good idea what is absorption. Then from the liver it will go to the heart. heart will distribute this to various tissues, and then the drug has to be removed out by metabolism and then by excretion. So this 4 topics is the one which we are going to study now. Now let us move on to one by one. Let us go by one. The first concept in pharmacokinetics to be understood is a concept called absorption. Yes. Now what do you understand by the term absorption? Now absorption is simple. Suppose you are giving a drug by various routes. From routes of drug administration. So we give drugs by various routes. You know that. We give it by oral, subcutaneous, IV, then transdermal. We have discussed that. Now routes of drug administration, from there the drug has to reach the blood vessel. The drug has to reach the blood vessel. So this is the blood vessel. So the drug has to reach the blood vessel, and reaching of blood vessel is what we call by systemic circulation. So from route of drug administration to systemic circulation, we call it as absorption. So let me repeat again for you all. From the route of administration to the blood vessel, that is to the systemic circulation, we call this process as absorption. Now in absorption, to understand this is the routes, and the absorption depends on some transport mechanism. So there is some transport mechanism. Through this transport mechanism, the drug gets absorbed. Now first I will be discussing the routes of drug administration. Second, what are the transport mechanisms? And third, what we are discussing will be the factors affecting absorption. So on what factor the drug absorption depend? These are the things which we'll be discussing separately. Right. Now first thing is the routes. And can you tell me some routes? You know that answer. So tell me, what are the routes? I'm waiting for your answers. You know the answer for that. So what are the routes of drug administration? Now, route of drug administration, we classically classify them into 2 important things. One is the systemic route, and one more is the local route. So you know that we classify them into systemic route and local route. And in systemic route, we have 2 varieties. One is the enteral route, and one more is the parenteral route. So what are the routes that come under enteral? It is the oral, sublingual, and the rectal. So all these 3 routes come under the systemic route. That is oral, sublingual, rectal. So parenteral routes, they are IV, intramuscular, intradermal. IV means intravenous, intramuscular, intradermal, subcutaneous, inhalational, then transdermal, and even into the bone marrow, it is called intraosseous. So these are all the parenteral. That means par means beyond enteral. They don't touch the GIT. That's why they are called parenteral routes. Now my question is, among this parenteral route, which route has highest bioavailability? Can somebody answer? And which one has fastest absorption? Let us take a guess. Which route has 100% bioavailability and which route has fast absorption? Waiting for your answers. Now moving on to the local. We have 2 important. The meaning of local is the drug works where it is given. It will not go inside the body and circulate everywhere. So local, we have 2 things. One is the application topically, second into the deeper tissues. Second into the deeper tissues. Now the topical, you know that it is on the skin and mucous membrane. So application on skin and mucous membrane, the ear drops, nasal drops, or the eye drops. So all these are topical routes. Now deeper tissues, it is intra-arterial, then intravenous, not intravenous, intra-articular, that is into the joint space, and intrathecal, that is into the spinal cord. So these are the various routes of drug administration. I will come to that later. Just write it down and you all know these things. I will tell you the absorption part later. How do they affect? Yes, you are all right. The 100% viability is seen with IV route. I will tell you why it is 100% later. So please write down the 100% viability is obviously with IV route. And the fastest absorption is seen with inhalation route. So fastest absorption and fastest onset of action is seen with inhalation route. Okay, so that's the reason we get the action very fast with inhalation route. Very good. Chaitri, Manav, Simran, Prithvi, Agnivesh, Kovet, yes, Karthik, Aidagni. So these are the routes. One is called systemic and one is called local. We have enteral, parenteral, topical, and deeper tissues. Now let us move on to the drug transport. The next concept which I want to discuss, first is the route and then how the drug is transported from the route of administration to systemic circulation. Now let me take the classical example of paracetamol. This is the intestine. And now the drug which you are given, the drug from the site where you are given has to move inside. It has to get absorbed into this. And there we have some transport mechanisms. We have certain transport mechanisms. So what are the drug transport mechanisms which will help the drug to move inside? The transport mechanisms are mainly two varieties. The drug may move by the method of passive. It is called passive transport, and one more is called active transport. The drug may move like by a passive transport or active transport. You know this from your physiology also. In passive we have two varieties. So passive we have two varieties. Either it can be by simple diffusion. The movement is by simple diffusion, or one more concept is by facilitated diffusion. So these are the two things. Now active, we have two varieties. So active, there are two varieties. One is called antiport and one is called symport. Now what is the difference between both? That is passive. Here no ATP required. That is no energy. No ATP or energy required to do this process, but active requires ATP. That is the only difference. Now simple diffusion, this is the most common way. That means the drug moves from high concentration towards low concentration. This is what we mean by the simple diffusion, high concentration to low concentration. And this is the most common mode of drug absorption. Most common mode of drug absorption is simple diffusion. So if they ask in the exam, what is the most common mode of drug absorption? The answer is the simple diffusion. So when you give IM injection, it will go to the muscle. From the muscle, it will simply diffuse from higher concentration to lower concentration, that is to the blood vessel, and then get absorbed. So that is the most common mode of drug absorption. This is also an MCQ asked. Most common mode of drug absorption. Now this facilitated diffusion, it requires carrier. It requires carrier. It requires carrier. For example, the transporter is that is glucose transporter. Now it requires carrier, but simple diffusion doesn't require a carrier. Now active transport, it requires ATP. The meaning of antiport is the drug, that is the transporter, will exchange opposite ways. For example, sodium, potassium, ATPase. Now this is a pump which will throw the sodium out and brings in potassium. Similarly, we have H plus K plus ATPase pump. And can you tell me which drug works on this H plus K plus ATPase pump? Waiting for your answers. Which drug acts on this H plus K plus ATPase pump? You know the answer. Symport. It is sodium glucose transporter. So sodium and glucose moves in the same direction, that is called SGLT. So the difference is here, simple diffusion doesn't require a carrier, facilitated diffusion requires carrier. But passive means they don't require any energy or ATP, but active transporters, they require ATP. That is, they require energy for the movement. So this is the drug transport. Now, you have taken the paracetamol has to be shifted from intestine into the blood vessel. But one important point you need to understand here is, this is the intestine, right? Now, in drugs, we have two varieties of drugs. I just want to tell you that. In drugs, we have two varieties. One drug, we call it as lipid soluble. And one group of drugs, we call it as water soluble. One, it is called lipid soluble, and one we call it as water soluble. Now, you tell me which drugs can easily diffuse without any transporter. Obviously, the drug which can easily diffuse is lipid soluble. Why? Lipid soluble, because the cell membrane is also made up of lipid, so it will easily allow a drug which is lipid soluble. Yes, you are all right, Karthik, Ayush, Neha, Chaitri, Manav. Yes, proton pump inhibitors, they block H plus K plus ATPase pump. I am very happy that you are answering this and you're remembering the concept. So lipid soluble can easily cross this. But what about the water soluble? Water soluble is usually not allowed inside because the water soluble cannot bypass this lipid bilayer of the cell membrane. Water soluble cannot bypass this lipid bilayer, but lipid soluble will easily go inside. Now, what about the water soluble? Then how to move this water soluble drug? Now, water soluble drug, if they have to be moved, I'll take one more image and show it to you. In this, there is a space between cells. We call it as paracellular space. Now, if the water soluble drug is very small, then it can pass through this paracellular spaces. It can pass through this paracellular spaces, that is between the cells, or there are channels called aquaporins. So there are channels called aquaporins. Through that also the water soluble drugs can enter inside. But this is only seen with few drugs. Only if they are very small. For example, water soluble drug which is very small is a drug by the name ethanol. You know alcohol, right? So alcohol is very small molecule, so it can easily cross this. So remember, who can easily cross a membrane? It is lipid soluble. Who cannot cross? It's a water soluble. And if it is water soluble, at least it should be very small, or it should be transported through a channel called aquaporin channel. Clear, guys? Now, once you are clear with this, let me come back. What are the factors that affect absorption? So third concept I told you is what are the factors affecting drug absorption? Factors affecting drug absorption. Now, whenever we synthesize a drug, the drug either should be an acid or a base. Now, I cannot synthesize a drug which is strong acid. I cannot tell the patient to drink nitric acid, sulfuric acid, no, because it will burn. That's the reason the first thing that will affect the drug absorption is the chemical nature of the drug. Now, the drug will be available either as weak acid or it is available as weak base. So it is weakly basic drug or it is weakly acidic drug. So like this they are available or they are available as neutral drugs. So majority is either they are acidic drugs but not a strong acid, weakly acidic drug and weakly basic drug. Can you give an example of an acidic drug? You know that already. The drug is, a weakly acidic drug is aspirin. What is the full form of aspirin? It is acetyl salicylic acid. So in the name itself we have acid. So that's an acid. Second is barbituric acid. Barbituric acid and the penicillins. Penicillins, cephalosporins. So I will tell you this concept when I come to these topics also. So write down thiazides and loop diuretics. Loop diuretics. So these are called acidic drugs. At least if you don't remember the last two, at least remember aspirin and barbituric acid. They are very important. Remember they are acids. Now basic drugs. The basic drugs are morphine. You know morphine is an opioid. Morphine and one more is atropine. These are weakly basic drug. Weakly basic drug. So this is the chemical nature. Very good. Now why should I know whether it is an acid or a base? Why should I know that? Now let me make you understand still with one more image. Now what happens? What is the rule number one? If you place an acidic drug, if you place an acidic drug in an acidic pH, if you place an acidic drug in acidic pH, this drug will be non-ionized. So if you place an acidic drug at acidic pH, the drug will be non-ionized. And if a drug is non-ionized, we call it as lipid soluble drug. A non-ionized drug is lipid soluble drug. That means what is the importance? If it is lipid soluble, the drug is easily absorbed. The drug is absorbed easily. Clear? So acidic drug present in acidic pH, it will be non-ionized. That means lipid soluble, absorbed. That is the rule number one when absorption. Now same thing, if you place the basic drug in basic, that is called alkaline medium. So let me write it as alkaline medium. And here you can write acidic medium. Instead of pH, it will be ideal to write the acidic medium. That will be ideal. Now in alkaline medium, a basic drug will be non-ionized. So non-ionized, so it will be lipid soluble. LS for lipid soluble, so it can get easily absorbed. Okay, rule number one you understood. If the drug and the medium are same, the drug will become lipid soluble, that is non-ionized and easily absorbed. That is the concept number one. Clear? Now what we'll do is we'll make it ulta and see what happens. What happens here is, suppose I place an acidic drug in alkaline medium, what happens now? Now what happens in this medium? The drug will be ionized. Now what do you mean by ionized? That is, the drug is charged. A compound which is charged cannot cross the membrane. So what we call it as water soluble drug. So water soluble drug is not absorbed unless there is pores or something like that. So this is easily cleared from the body. So it is easily cleared out. That means it can be going out of the body. It is not absorbed, that is a meaning. It is easily cleared or it is not absorbed. Now same thing with the basic drug. Basic drug, if you place it at acidic medium, it will be ionized and it will be easily cleared. Easily cleared. This is the second concept. Now here, along with absorption, what you have to write is it crosses membrane. So if it is non-ionized, you can write it crosses membrane. It crosses membrane. And if it crosses membrane, it is easily absorbed. So these two you understand. Now I will tell you why you need to understand this. And you will answer this question. Now this is the esophagus. This is the stomach. And this is the intestine. Clear? Now if I give aspirin, if I give to a person aspirin and I give to a person another drug, morphine, can you tell me where the morphine is absorbed and where the aspirin is absorbed? So I have given two options to you. Can you tell me where the aspirin is absorbed and where the morphine is absorbed? Two options, whether morphine is absorbed in the stomach or in the intestine. Please answer this. I'm waiting for your answers. Where is aspirin and morphine absorbed in this form? Yes. Now remember, the pH of the stomach is acidic. That is, it is less than 2. The pH is less than 2. Obviously, in the stomach, the drug which is absorbed is aspirin, because acidic drug in acidic pH will be absorbed. So most of the aspirin, the absorption is in the stomach. But morphine, it is basic drug, and in alkaline medium, it will be absorbed more in the small intestine. Morphine is more absorbed in the small intestine because a basic drug in the basic medium, that is alkaline medium, is absorbed. Very good, Neha, Ayush, yes, Preeti, COVID go away, Agnivesh, then Shubham. Very good. So this is the concept which we had to understand where the absorption occurs. Right. Now this is the concept to understand absorption. Yes, Daria, you're right. Nidhi, Pranav, Manav, Vanshika, Siri, you're all right. The same concept we applied in one more problem.